Hello students, I am Shipra Banerjee, Associate Professor of Brainwave University. I want to deliver a lecture on antimicrobial. You know, bacteria or microbes are the important constituents of the environment, but they are causing different diseases to the human body. So we should kill them. If we don't kill them, then they can cause different infections to our body. So we can define the antimicrobial as the agents which are used to destroy or inhibit the growth of different pathogenic organisms. Microorganism means the bacteria, virus, fungi, amoeba, protozoa, everything can be classed called as the microbes, which can be seen through the microscope. So this can be inhibited their growth or can be destroy their cycle. So they are classified into 6 categories: antiseptic, disinfectant, germicide, bacteriostatic, sanitizer, and sterilization. Okay. So antiseptics are those agents that prevent the sepsis by destroying or inhibiting the growth of microorganisms in living tissue. That means they will be working on the living tissue if there is any cut or is any abrasions like this. So that will be applied to the skin surfaces or the living tissues. Okay. An ideal antiseptic should destroy the bacteria, spore, fungi, virus, and other microorganisms on the living tissue of the host. Antiseptic can be used also in the prevention of the hands of surgeons, dentists, nurses, pharmacists, who are in direct contact with the patients and the contaminous infections also. Now coming to the disinfectants, these are the substances which prevent the infection by the destruction of the pathogenic microorganism and are generally employed for inanimate objects and materials such as instrument room, hospital, home equipments, etc. That means they are used in the non-living tissue and to get rid of microorganisms. All the disinfectants are bactericidal in nature because they are killing the bacteria or viruses. Okay. Now, coming to the next slide. Now, germicides. These are the agents which kill the microorganism. The more specific term which is used for the bactericide, fungicide, virucide, and ambicide. That means they are killing the bacteria, fungus, virus, and the amoeba also. Now, coming to the sanitizer, that is basically disinfectant used to maintain the public health standards and called as a sanitizer. Sanitation is mainly concerned with cleaning or washing away the organism. Next, coming to the sterilization. These are the stages which are used to complete destruction of all living organisms, including bacterial spores. It can be done by physical methods, by application of the heat or radiation, or by chemical means. Like you can see, whenever we are just boiling any substance in the boiling water, they can kill the microbes. And by radiation, like UV light can also kill the microbes. And chemical, like fluorination type of compound can kill the microbes also. Now coming to the mechanism, how these compounds are working on bacteria, there are 3 methods: oxidation, halogenation, and protein precipitation. Now coming to the oxidation process, actually in case of proteins for bacteria, there are sulfur hydryl present in the bacterial structure. So if it is oxidized, then the protein structure will be broken down. So as a result, the bacterial genetic combination will be stunted their growth. There will be no cell division for the bacteria. Next, for the halogenation. So here also they are working on the amide linkage of the proteins. See, this is the CONH linkage, that is the amide linkage that is present in the protein of the bacteria. If we use like chlorine or chlorine or fluorine, so there will be halogenation and the structure of the protein will be broken. As a result, the bacteria or virus will be killed. Next, protein precipitation. This is widely used in the downstream processing of the biological products in order to concentrate protein and purify them from various contaminants, like astringent. Whatever the fat curry or alum you can use after the shaving, so they can precipitate the. As a result, there will be no abrasions, or if there is any blood vessels has been affected, so their bacteria cannot affect because the protein will be precipitated for the bacteria and they will not cause any toxicity or any wounds. So they can clean the face and prevent the acne breakouts. They can stop bleeding and hemorrhoids also, Like in case of piles, you can see whenever the patient having constipation, they are so forced to remove the stools, but hemorrhoids are causing. So iodine or cis bath is used where patient is sitting in a jar or hot warm water with forbidden iodine or vitamin solution. They can prevent the hemorrhoids. Okay. So there are different substances which can be used as the antimicrobial like potassium permanganate, then potassium permanganate, and next boric acid that is used in the borolin or for wound cleaning. Next, there are different agents like iodine. This is also one of the important substance. Next, scopolamine iodine. Next, Duval's iodine. That is one of the. These are the different substances which are used for the antimicrobial. Okay. Now coming to the potassium permanganate. See here you can see the potassium permanganate having KMnO4, molecular weight 158.03. Synonym is permanganic acid. It should not contain less than 99% and not 5%. Next, how can you prepare? So KMnO4 is prepared by mixing a solution of potassium hydroxide with manganese dioxide, potassium chlorate. So the mixture is boiled to with KMnO4, potassium manganate. The next chlorine gas is passed through the potassium manganate solution, resulting to produce potassium permanganate solution. K2MnO4, where chlorine gas is passed and it will produce potassium permanganate KMnO4. Now coming to the physical property, they are the purple or prismatic crystal that can be seen like this color of the slides with metallic luster. It is odorless, it tastes sweet and astringent, and it decomposes at high temperature. At high temperature, the structure can be broken, the color is appearing. It decomposes at higher temperature, KMnO4, K2MnO4 plus MnO4. Potassium permanganate is dissolved in potassium manganate. Potassium permanganate releases the nascent oxygen, which by oxidative mechanism inhibit the action of hydrogen and therefore assay. This is standardized or getting the purity by the redox titration. Coming to the uses, it is used as a topical anti-infective. Its solution is used as an antiseptic in mouth and clinic for ulcers. It is used in treatment of urethritis. Antidote to the venom of barbiturate alkaloid. Antiseptic for veterinary purposes also. Next, we can go to the boric acid. That is formula is 3BO3 and molecular weight is 61.83. And synonym is boracic acid and oxalic acid. Standard 99.5 to 105%. So this is occurring in seawater in many plants, and although the largest source is occurring in the borax, that is a resonite borax, Na2 and the borax formula is Na2 porocalcite that is present in CaB7 and polymanite 11. A method of preparation. The borax is used for the preparation of acid. Boiling solution of borax is added with sulfuric acid and water to produce boric acid. Na2 and sulfuric acid. So as a result, Na2H3BO3. The solution is filtered and crystal of boric acid is separated and washed until they become free from sulfate ions. Next. Now, commercially boric acid is separated by So certain naturally occurring habits, calcium borate can be used, whereas it is reacted with sulfur oxide and calcium sulfide is prepared. That is again reacted with the boric acid. So as a result, HCbO3 will be. So coming to the physical properties, it is odorless with crystalline powder. It's having six-sided crystals, slightly acidic and bitter in taste. It is soluble in water and alcohol, stable in water and alcohol also, stable in air and metal. So 170. It's 1.9% solution in water is isotonic serum. On heating at 100% it produces 100 and it produces H3 and H2. Serum also. With alkali substance, it salt due to acidic nature. And identification test can be done. This faintly acid. The boric acid is local anti-infective and is used in the preparation of various dusted powder, antiseptic cream, ointment, bacteriostatic and fungicidatic in wash, mouthwash, skin lotion, emollient antiseptic ointment, cream of diaper rashes, while used in the water solution medication. Caution: it's toxic if ingested, so it should not be ingested for the internal infection. Now coming to the iodine solution. Now iodine can be found from chili saltpeter, from the wheat, from the seasides area. That is seaweeds known as, see the name, Laminaria digitata and Fucus vesciculosus. The seaweeds are dried and burnt. Their ash, which are also called kelp, is extracted with water. This extract is purified to remove sulfate, and sulfates, thiosulfate. The purified extract is treated and exerted for precipitation of the iodine. So here, sodium iodide and as of CaCl. From chili saltpeter, that is also a metallic salt. The alkali metal nitrate salt is used as chili saltpeter. Large deposit is to be 9 kb. To distinguish it from the ordinary saltpeter, potassium nitrate. The mineral form is also known as the nitratite sodium nitrate. Sodium nitrate is a white solid base of chili saltpeter and sodium iodide also. From this we can separate carbon. It is violet black, has a shine or glow, not a strong or harsh odor. Crystalline structure is rhombic, density is heavy, highly concentrated iodine, is poisonous and may cause serious damage to skin and tissue. Now coming to the chemical properties. Molten iodine may be used as a solvent for iodides. The electrical conductivity as it described for self-conduction like iodine, deionized to iodine plus or I3 minus. Mechanism: iodine in solution acts as mild oxidizing agent, which can mediate to the formation of hypoiodous acid, which further releases the nascent hydrogen, which does the oxidation of hydrogen H2, which I HL. Yes. In its over-the-counter iodine is used in tincture, ointment, or gel, skin, and treat infection. Iodine is bacteria and cause infection. This type of use of the skin also. Povidone iodine, one of the important type, also known as the iodine, is an antiseptic skin disinfection before and after surgery. It's a complex of iodine and povidone polymer, also known as the polyvinyl pyridine and iodopovidine. Is an antiseptic for skin disinfection before and after surgery and on the heads of healthcare professionals. It may also be used for minor use. It may be applied as powder. The complex contains 9% to 12% available iodine. It was by releasing iodine results in a depth of range of factors. It belongs to the class of iodophore are the components of iodine, Jacobs carrier, liver iodine, where it is required solutions in agents. There, Lugol's iodine. This was made in 1829 by the French physician Jean Lugol. It is one of the World Health Organization for essential medicine, known as effective and safe medicine in the health system. Lugol iodine is available as generic medication and over the Lugol solution is available as strains of iodine. Large volume of concentration may be subject to regulation. Physical properties. Lugol's iodine, also known as the iodine, and it is a solution of calcium iodine in water. Its medication and disinfectant used for a number of purposes and taken by mouth to treat thyrotoxicosis and surgery can be carried out, protect the thyroid gland and can treat thyroid. When applied to the cervix, it helps in cervical cancer also. As a disinfectant, it may be applied to small wounds such as little sheep. A small amount may also be used for emergency disinfection. Now, medication that is used for thyroid Graves' disease, antithyroid drug, levothyroxine that can be applied to the vagina or cervix for colposcopy, bioscopy, mucovaginal junction, that can be also used. So, this I'm completing the presentation and thank you for listening.